AI and colonoscopy is really a growing field. The last few years, there have been several groups looking at how we can do optical biopsy, which is finding what kind of pathology we're looking at with the polyp, and also detection tools, so helping us to actually find those polyps first. And lots of groups, including ours, have done really good work in that. It's moved the field forward, but what we lack still is the ability to move that into clinical applicability, right? So we need these tools to come soon because everyone's talking about AI, and it's like, when does it happen? Is this futuristic? Is it 5 years away? Actually, it's probably in the next year or two, but it needs to be full workflow type solutions. So what we presented this morning was helping the doctor to find a polyp, okay, so increase your detection with AI, and then once that polyp is found, you can seamlessly press the button on the scope to go into blue light or blue-green light, and you can then optically biopsy the polyp. So it's a much more practical solution, which is really what we need, because if you give a tool to doctors and they have to slow down or they have to turn around and press a bunch of buttons, they're probably not going to adopt it. Yeah. Tracking is an important progression, I think, in AI, particularly when it comes to optical imaging. If you can track something, so you put a box around something, shall we say a bounding box, and then you extract features from what's contained within that box, give it a signature, you can track that signature as things move. The polyp moves, the patient moves, the scope moves, the camera moves, and that allows you to do some tracing. It's early work, okay, but it allows you to follow things. It also allows you, let's say, when you have multiple polyps, to apply a unique identifier to individual areas, so that you can say, okay, when I'm now engaging optical biopsy mode with the AI, it's looking at that polyp over there. And now, because I have a unique identifier with this one, it's telling me what that pathology is. So it gives you a kind of quality assurance type measure as well. It is early stage. Tracking should hopefully be more robust in clinical practice, and it will allow us to follow lesions, maybe even temporally. But right now, it's just an advance. We could wait for perfection, and we could do this in 5 years' time. Or we can say, okay, we've already got something that's good enough right now. So if you can take a doctor's performance, his ADR or her ADR is 20%. And if you can make that 25% using AI, that's already a win. It's still a low level, but that's a win. Same with optical biopsy. That's a bit more challenging because we don't want to necessarily change current standard of practice with pathology. But if you can train the human eye to know what it is they're looking at, you really got just to overall improve performance. Other things that need to be addressed, regulatory clearance, of course, consumer acceptance, physician acceptance as well. Some physicians have concerns about, will it slow them down? What's the billing implications for them? Some of the tools that would be very good to have sooner rather than later will be an ability to do some sort of auto-reporting. So when you see a polyp and detect it, it goes into the report straight away. That you have landmark annotation, that you can score the bowel prep. Some groups are doing that, including ours, looking at how you can grade the bowel preparation. Those are some of the key things. One thing that people ask a lot at this meeting and yesterday of people like myself is, can you size the polyps with AI? And I think the answer is yes, and we've talked a lot at a forum last night about how to move forward with that. But that's a little bit of a block with some groups so far, because if we're going to give policies based on size, we need to know that we are accurately sizing them. But I think we already have robust solutions now that should be in our practice very near future to help us. And then as we adopt it, we'll learn more. What are the pros and the cons? What are the challenges? How do we need to adapt it, right?